Republic Act Number 8980 or Early Childhood Care and Development or ECCD. Republic Act 8980 is an act promulgating a comprehensive policy and a national system for early childhood care and development, providing funds therefore and for other purposes. What is ECCD? Republic Act 8980 defines it as a full range of health, nutrition, early education, and social services programs that provide for the holistic needs of children 0 to 6 years. Nutrition intervention at 0 to 6-year-old significantly improve psychosocial development and physical growth. Combined interventions to improve both physical and psychological development and have greater impact than either or alone. In Section 1, short title, this act shall be known as the ECCD Act. In Section 2, the Declaration of Policy. It is hereby declared the policy of the state to promote the rights of the children to survival, development, and special protection with full recognition of the nature of childhood and its special needs, and to support the role of parents as a primary caregivers as their children's first teacher. In Section 3, which is the objectives. The objectives of the National ECCD System are: first, to achieve improved infant and child survival rates by ensuring that adequate health and nutrition are accessible to young children and their mothers from the prenatal period throughout the early childhood years. B. To enhance the physical, social, emotional, cognitive, psychosocial, spiritual, and language development of the young children. C. To enhance the role of parents and other caregivers as the primary caregivers and educators of their children from birth onwards. D. To facilitate a smooth transition from care and education provided at home to community or school-based setting and to primary school. A. To enhance the capabilities of service provided under supervisors to comply with quality standards for various ECCD programs. F. To enhance and sustain the efforts of the communities to promote ECCD programs and ensure that special support is provided for poor and disadvantaged communities. G. To ensure the young children are adequately prepared for the formal learning system, that both public and private schools are responsive to the development needs of these children. H. To establish an efficient system for early identification, prevention, referral, and intervention for the development disorders and disabilities in early childhood. I. To improve the quality standard of public and private ECCD programs through, but not limited to, a registration and credential system for ECCD service providers. Section 4. Definitions. For purposes of this Act are: first, Early Childhood Care and Development System refers to the full range of health, nutrition, early education, and social services programs that provide for the basic holistic needs of young children from birth to age 6 and to promote their optimum growth and development. These programs includes: first, center-based programs such as the daycare service established under Republic Act No. 6972, public and private preschools, kindergarten or school-based programs, community or church-based early childhood education program initiated by non-government organization or people's organization, workplace-related child care and education programs, child minding centers, health centers and stations, home-based programs such as the neighborhood-based play groups, family daycare programs, parent education and home visiting programs. ECCD service providers include the following professionals, paraprofessionals, and volunteer caregivers who are directly responsible for the care and education of the young children through the various center and home-based programs. They include, but are not limited to, daycare workers, teachers, teacher aides, rural health midwives, social worker, community health workers, barangay nutrition scholar, parent effectiveness service volunteers, child development workers, and family daycare providers. ECCD curriculum refers to the age-appropriate and developmentally appropriate educational objectives, program of activities, organized learning experiences, and recommended learning materials for children that are implemented by service providers through centers and home-based programs. It shall consist of national program goals and guidelines, instructional objectives, and content outlines integrating local learning experiences and indigenous learning materials. D. Parent education. This refers to the various formal and alternative means of providing parents with information, skills, and support system to assess them in their roles as their children's primary caregivers and educators. This includes public and private parent education program linked to center, home, and media-based child care and education program. Section 5. System Framework and Components. The ECCD system shall include the following components. A. ECCD Curriculum, which focuses on children's total development according to their individual needs and socio-cultural background. B. Parent Education and Involvement, Advocacy, and Mobilization of Communities. C. Human Resource Development Program. D. ECCD Management. E. Quality Standard and Accreditation. In Section 6, Establishment of ECCD System. The National ECCD System shall be established in at least 3 regions each year, as may be determined by the National ECCD Coordinating Council to achieve national coverage over a 5-year period. In Section 7, Implementing Arrangement and Operational Structure. The implementation of the National ECCD System shall be the joint responsibility of the national government agencies, local government units, non-government organizations that are accredited to deliver the services or to provide training and technical assistance. Section 8. Creation of National Coordinating Council and Coordinating Committees for ECCD. This is to ensure the sustained interagency and multi-sectoral collaboration from the national, provincial, city or municipal to barangay levels, and National Coordinating Council and a provincial, city or municipal and barangay coordinating committees shall be organized. In Section 9, Financing ECCD Programs. ECCD programs at the community level shall be financed through a combination of public and private funds. All public ECCD programs providers shall prioritize young children from families who are in the greatest need and who can least afford private sector programs. In Section 10, the appropriation. For the implementation of this act, the amount of 400 million pesos per year for 5 years is hereby appropriated for the National ECCD program of the Council effective upon approval of this act. Said amount shall be funded from the gross income of the Philippines Amusement and Gaming Corporation and shall be directly remitted in 4 quarterly installments to a special account of the Council. Thereafter, such sum as may be necessary for the operation of the Council shall be including the General Appropriation Act. In Section 11, the Annual Report. The Council shall, at the close of each calendar year, submit an annual report to the Congress, giving detailed accounts of its proceedings and accomplishments during the year, making recommendation for the adaptation of measures that will improve the National ECCD System. Section 12. Separability Clause. If any provision of this Act is declared unconstitutional, the same shall not affect the validity and effectivity of other provisions thereof. In Section 13, Repealing Clause. Pertinent provisions of Presidential Decree No. 603 and Executive Order No. 233, all laws, decrees and executive orders and presidential proclamations, rules and regulations, or part thereof, contrary to or inconsistent with the provision of this Act are hereby repealed or modified accordingly. Section 14. Implementing Rules and Regulations. The Council, in consultation with all the appropriate government agencies and non-government organizations, shall formulate and issue the necessary rules and regulations for the implementation of this Act within 90 days after the effectivity of this Act. Section 15. Effectivity Clause. This Act shall take effect 15 days after its publication in the Official Gazette or in at least 2 newspapers of general circulations. That's all, and thank you for listening.